Hi, I'm Dr. Wilcox. Today I've been asked to talk to you about ovarian reserve. Most women know they're born with all of their eggs and they deplete those eggs as they get older, as opposed to men who are able to produce sperm throughout their lifetime. Ovarian reserve testing is one of the first things we do as fertility specialists when we're trying to assess your overall chances for success. It turns out that women have their maximum number of eggs before they're born. At about 20 weeks, you have around 6 to 7 million. By the time you're born, only 1 to 2 million eggs remain. At the first period, about 300,000 eggs. And by age 37, it's about 25,000 eggs. So there's dramatic reduction in the number of eggs, even though when you start to have regular cycles, you're only releasing 1 egg per month. You're still losing hundreds of eggs every month. So reserve testing is a big part of the fertility evaluation, and there are a couple ways of doing the egg reserve assessment. The most popular is to do an antral follicle count. We can do that with a simple ultrasound, or we can look at the ovaries and see the number of eggs that are actually available that month to compete for maturation. There's fluid around the egg, so we're able to see the fluid easily and count the number of eggs, and that's proportional to the number of eggs left in the ovary. A normal number of follicles is usually around 15 to 25, and if you have less than 10, that's first evidence of diminished ovarian reserve, and if you have less than 5, it's severe diminished ovarian reserve, and those patients will often struggle to get normal eggs when we do fertility treatment. Another way of assessing your egg reserve besides doing an ultrasound is to perform blood tests. And early on, we use the day 3 follicle stimulating hormone and estradiol, and then we started doing what's called a clomiphene challenge test, which still measured follicle stimulating hormone after inducing a FSH and LH surge using Clomid. It was measured on day 10. We were looking for an exaggerated increase in the follicle stimulating hormone, suggesting a reduction in the egg reserve. The problem with follicle stimulating hormone as an assessment of your egg reserve is that it really only tells us if the egg reserve is low. If the FSH is elevated, that's an indication that the egg reserve is diminished. Typically, if it's over 12, the prognosis is reduced. If it's over 20, then the prognosis is usually considered poor. But if it's low, it doesn't necessarily suggest you have an excellent prognosis, so it can be misleading when you get your FSH and it's a low level. Unfortunately, it's not always a great indicator of an excellent egg reserve. Other indicators, Inhibin and anti-Müllerian hormone, are more popular. In our center, we use anti-Müllerian hormone. It's correlated pretty well with your egg reserve, and we like to say the good rule of thumb is you're going to get about 1 usable egg for every 0.2 of the AMH. A normal AMH is around 3.5. If the AMH is less than 2, again, that's evidence of a diminished ovarian reserve, and if it's less than 1, we usually struggle to get genetically normal eggs. So the AMH in our center and the antral follicle count are 2 very popular measures for ovarian reserve, and they can definitely help us counsel patients. Through genetic testing, we've learned that the age of the female and her egg reserve are probably the 2 most important data points to predict the percentage of normal eggs, or the ratio of abnormal eggs to normal eggs. So hopefully you found this helpful. Thank you very much. We look forward to seeing you.